There are multiple costs when it comes to breast cancer. A number one cost is an emotional cost. It's the trauma of the diagnosis, the trauma to you and members of your family. That has a cost. There's the cost of breast cancer when it comes to lost days at work or having to hire other people that help with care at home. Then there are the obvious costs of breast cancer depending on what kind of insurance coverage that you have and what the co-pays are like and what the stage of the breast cancer is in the first place. The cynic would say, well, gee, mastectomy without reconstruction is a low-cost option. Yeah, it sure is, but it has a high cost when it comes to the emotional side. So typically the costs for breast cancer involve the surgery. They involve then the other adjunctive treatments. Those other adjunctive therapies or treatments involve often anti-hormonal therapy, perhaps chemotherapy, perhaps radiation therapy. There are some set of circumstances that I've seen where patients have had to use assistance from their own state governments to cover the co-pays because their co-pays are so high for the policy that they have compared to what they're living they're making, et cetera, et cetera. Fortunately, there are financial advisors around. In most hospital settings, there are social workers that can help work our way through this. One of the other questions that comes up is, well, wait a minute, maybe we can lower overall health care costs, and particularly the cost of breast cancer treatment, if we use complementary or alternative forms of treatment. Those of us who are in the field full time, most of us, including myself, don't have objections to things that are complementary. In other words, things like acupuncture as an example, things like yoga as an example, obviously exercise and things related to that. Clearly, if somebody's diagnosed with depression, they need to have that treated either by routine regular medications or some of the over-the-counter medications that can work, such as St. John's wort, etc. So overall, I don't think that complementary and alternative approaches to breast cancer are going to lower overall costs. I think that as we move down the road in healthcare delivery in the United States, there's going to be a greater tendency to package things together, to bundle things into more of a cohesive dollar amount coming to doctors and hospitals. Things like that, I think, are going to happen. If you find yourself in a particular financial bind right now, please consult with the hospital that you're working with, see what financial advisors may be available. Please also, if you're considering any kind of complementary therapies, that you discuss this with the members of your multidisciplinary team. Hi, I'm Dr. Jay Harness, and I want to share with you important information that I believe that every newly diagnosed patient with breast cancer needs to know.
I'm a breast cancer survivor.
I am a breast cancer survivor.
I am a breast cancer survivor.
And I want every woman to know
about personalized breast cancer treatment
and the genomic test.
A test that helps guide a woman and her doctor
to the best treatment options for her.
Pass it on.